Hillary Clinton returns to the campaign trail today, 4 days after nearly collapsing outside that 9/11 memorial ceremony in New York on Sunday. She was later diagnosed with pneumonia and has been off the trail until today. It comes as Donald Trump's taped episode of Dr. Oz aired, in which he revealed a summary of his recent physical. So joining us to talk about what it all really means and why we should care is Dr. Richard Chaffoo. Dr. Chaffoo, thanks so much for being here.
Good to see you, Jen.
You know, in this interview when I was preparing, I was doing some research and I read this really interesting New York Times article that said back in the day, FDR was able to keep the fact that he was in a wheelchair quiet for quite a long time. Now candidates can't really even sneeze without the media kind of freaking out. So where is the line between, yes, transparency we need to know, and we're overreacting a little bit?
So you're right, Jen. The pendulum certainly swung far in the other direction. In fact, even JFK, we know, had a serious disease called Addison's disease, which is a hormonal imbalance that may have had some effect upon Khrushchev during the Cuban Missile Crisis. So the important thing, I think, for the public to take away from this is what type of illnesses are important to know about. You know, obviously psychiatric disease would be very important to know about. Chronic medical problems that could affect their judgment or their ability to serve, taking medications, being under a doctor's care. You know, cardiovascular disease is unstable. We saw that similar with Vice President Dick Cheney. Also, any types of chronic pulmonary diseases, diabetes, vascular diseases. So there are some, you know, red flags that you need to look out for.
Dr. Chaffoo, both the Clinton and the Trump doctors sort of gave them a clean bill of health and said, yes, they are fit to serve. But I wonder, is it worth kind of getting a second opinion? I mean, is there some backdoor stuff going on that's like, hey, we'll throw you a couple bills. Can you please say that, yeah, they're fit to serve? I mean, do they ask for a second opinion?
That's a great point. And certainly when someone's going to be in the highest office in the world and commander-in-chief, that's not a bad idea to have a third party, someone relatively independent, perhaps at, you know, Bethesda Naval Hospital or some other institution where they can go through a battery or a series of tests and independently verify and determine that they're well.
Let me ask you about age. So if Donald Trump or Hillary Clinton were elected, they would be the oldest president. How does age sort of play into this? Hillary Clinton 69, Donald Trump turned 70 earlier this year.
Right. Well, Jen, you know, it's a very demanding job. Let's face it. They're woken up 2 and 3 in the morning, have to make some life and death decisions. We know obviously as we get older, our mental capacity, our ability, our need for sleep is actually greater. So certainly, you know, we talk about two types of age in medicine, Jen. We talk about chronological age and physiological age. They're not always the same. So if someone is, say, 70 years old, but has no significant or serious underlying illnesses, they might be physiologically more like a 60-year-old. On the other hand, someone who's 60 and has chronic medical problems like the diseases that I was talking about earlier on, may be more like a 75 or an 80-year-old. So it's really more in a case-by-case basis.
Yeah, and we even see that in non-presidential candidates. I've met 80-year-olds that act like they're 55 and 55-year-olds that act old. And Dr. Chaffoo, I want to correct myself. If Hillary Clinton was elected, she would be the second oldest president. Before I let you go really quickly, I only have a couple seconds. Is there anything we're not seeing that we should be?
You know, with our media today, I'd be really surprised if there's something that we're not seeing. I think the important thing also, you know, is the psychiatric history, because remember, a lot of these decisions that are made need really good, sound, strong judgment. And so actually, you know, there are things called MMPIs, which are psychiatric or personality testing, but I think that's an important factor that sometimes is overlooked. It's not just the lab tests that you want to look at, because those are kind of meaningless when they're left on their own, but you want to evaluate the whole patient, both from a physical and a mental perspective, to determine their suitability for office.
Well, and it'll be interesting to see if the public sort of demands, as you mentioned, a third party coming in and looking at both candidates. Dr. Chaffoo, thanks so much for being here.
You bet.